Welcome back, and you're still watching The Morning Breeze. We are now in the edition of the Topical discussion with me, Simon Kagwanjala, and I will be joined by Kampala Lord Mayor Erias Lukwago with Honorable Emmanuel Dombolumala, the head communications at the NRM Secretariat. We'll be unpacking the two presidential addresses. The first was the State of the Nation that happened on Friday, where the president highlighted a number of areas in terms of security, in terms of development, and where he sees the battle against corruption going. He even hinted on creating the Descendants Resistance Army. That is a crop, the new crop of young Turks, of the descendants of the NRM, of the fighters of the NRM, to help him advance or take forward the NRM agenda. We'll be discussing that. But even yesterday, the president spoke to the nation at the height of COVID-19, where he announced a number of directives, including the closure of schools and transport restrictions that start on the 10th of this month. What do you make of this, and how much or to what extent does it set the tone for President Museveni's new term? The Lord Mayor is in the studio. A very good morning, Lord Mayor. Good morning. What a pleasure hosting you this morning. Well, let's begin with the most recent. The president yesterday issued a raft of directives to curb the spread of COVID-19, including, among others, a proposal to start levying fees on persons who defy the rules. What did you make out of the entire speech of the president?
Let me start with that one, because you understand the background I come from. I always put on those legal lenses on each and every issue. His speech was not grounded on the law. When you raise such matters, people take them as if they are just irrelevant. But it's important structurally and administratively. There are no institutions to deal with the same. There are no organs to deal with the challenge.
Yeah, but you understand where he comes from. He says instead of overwhelming prisons and cells.
You see, everything has to be done within the parameters of the Constitution. Yes, he's the head of state, though we question his legitimacy, but he is there de facto. So the question is whatever you are doing within the parameters of the Constitution. You remember earlier on we had talked of a declaration of a state of emergency. If there is a resurgence of this magnitude, which we all agree, regardless of our political differences, that indeed there is a crisis, what do you do? There are legal mechanisms you have to come up with. Now it is even worse than it was before this second wave. Because previously, at least he had frontline soldiers. He had a cabinet task force. He had some semblance of discussion with members of parliament.
And the scientists.
But now it's his own war affair. With Diana Twine, with Okia, now he has drafted in the secretary to the treasury to sign the instruments. We questioned this, the legal basis of this earlier on, and said if you are not bringing it within the parameters of Article 110, which talks about the state of emergency involving parliament, involving other agencies and other stakeholders, the argument was Article 23 provides for enactment of a law that can curb a pandemic of that nature. That is, they invoked the provisions of the Public Health Act of 1935, which gives the minister in charge of public health to issue statutory instruments. And we have been operating within that frame, that you have statutory instruments. Every measure Mr. Museveni issues out, at least there's been an instrument.
It's backed by an instrument.
Backed up by an instrument signed by the Minister for Health. At least there was one on gatherings, there's been one on these meetings, on funerals, on weddings and whatnot, and so on and so forth. But here, I was shocked when I heard him say, because he was talking of levying, that the fines are going to be imposed by the Secretary to the Treasury, signing a statutory instrument.
Maybe
and I think every lawyer worth his salt would be really outraged by this statement.
Well, before you even engage in the legal gymnastics of this,
I told you I wanted to start from there.
It would really be nice to get the real picture, the current situation in the country of COVID-19, as the president announces new measures to curb the spread. What is the Ministry of Health saying, and how best can these new restrictions be enforced? Dr. Richard Kabanda, the head of promotions, health promotions in the ministry, joins us this morning. A very good morning, doctor. The president yesterday announced a number of regulations and directives. What is the current situation in regards to the pandemic? Where are the hotspots, and how is the ministry working around the clock?
Good morning, Simon, and viewers of NBS television. I'm happy to be hosted, and of course, I've been listening in to the Lord Mayor on the legal-related issues being discussed. I will not definitely go into the legal matters. I'm a public health expert, so I'll dwell myself on the technical issues that are driving some of the preventive measures that we are seeing in place. So it is, as of now, it is important for members of the public to know that the health situation in the country is worse than it was in the first wave, because those of you who are following up the epidemiological curve of the first wave, the current state that we are in, which was well described by the head of state yesterday, we almost reached this stage 4 months after. That was from as early as 1st April of 2020. It took us almost 4 months. And the current situation, I would say that it is much worse than the way it was last year. The current situation in the country regarding to provision of curative healthcare services, the hospitals are full. Many patients now are yearning to seek intensive care services, and it is really very difficult to access services in most of the government public facilities. As of yesterday, even most of the private institutions in Kampala metropolitan were actually full, accessing ICU services, or even having patients who actually need to be housed under the HDU, the high dependence units. So within the Kampala metropolitan, it was difficult to access services. So from the technical side, for us, our technical recommendations are based on the behavioral aspects that we have been having or seeing in the country. And most of these arise from the congregation centers that we have been seeing in most parts of the country. So most of the congregation settings, take an example of schools, churches, some of our cultural kind of functions, the funerals, etc. People have not been respecting the 200 maximum number of people. And you'll bear with me that our technical duty as the health sector is to advise and make technical recommendations. Enforcement is not entirely on our part. It is entirely on other MDAs. But of course, it may also not be very, very possible in the Ugandan context to have 100% enforcement from other MDAs who are supposed to manage this. That's why from our technical point of view, this takes us back to our individual community responsibility. And this is where we expect most of our political leaders from different parts of the country to support most of these initiatives, especially now that we are not in the political season. So you would expect that once leaders, for example, from Kampala, if the Lord Mayor, for example, takes lead in ensuring that he mobilizes people, not to congregate beyond the given maximum number of people, chances are high that people within that geographical area would definitely be able to adhere. We also noted that public transport was really one of those key drivers, because most of our colleagues who are manning this public transport have not been respecting the preventive measures. They did respect these I would say the first 2 weeks after they had opened up. And they have been taking many people. They have not been encouraging people to enter while having masks. Issues of sanitizing have not been done in more. Our colleagues who man borders, it's evident that many of them actually do not respect. And it will also take us to an element of us making recommendations of people not being able to move late at night, including actually the borders. The argument is simple, that at night it becomes very difficult for the country, even our colleagues in other MDS, to be able to enforce this, because everybody does whatever they feel is right for them. And of course, you can't rule out the socioeconomic factors and how these are actually driving. And I think partly that explains why mainly from our technical side it was difficult, or it wasn't one of the very first options to technically recommend a national lockdown, because we are cognizant of the socioeconomic factors. So we hope that during the first 2 weeks after the president's pronouncement yesterday, what we expect, like when I was coming to office, I realized that most of the people I met on the way actually are putting on masks. It's an indicator that people are aware now that we are in a terrible state. But Simon and viewers, you should also look at the human perspectives, that when cases are low, literally what that means is that the risk perception will definitely be low. It's a human nature. And in January, February, and part of March, we have been getting low, very few cases in the country, 10, less than 20, I would say. And that literally indicates that the risk perception is supposed to be low. Most of our hospitals that we are treating people were literally empty. Those of you who are in media or have been following, you remember even when we had a lot of media bash on why we had gazetted Nambole and had no patients. And for us, we are anticipating of the second wave, because many countries have actually gone through this. You know, from our neighbors in Rwanda, in Kenya, you know that they had what we call geographical lockdowns. Some parts of Kenya went into geographical lockdowns. People could not get out. People could not move in. Some of these parts, including Nairobi. And so we knew that since other countries have experienced more than one wave, we were preparing for the second wave. What is unique in our context is that we do not expect to see a rapid increased number of cases as we have seen within the shortest period of time. So for us to be able to control, we had to take a stand from the technical perspective that we need to limit on some of these congregational settings and try to monitor and see what will happen. Because, for example, if Kabanda or Simon or say the Lord Mayor areas goes back home, when he is positive, the number of people that will be damaged may not be many, because you look at say Simon or Richard and the number of people he or she stays with, and then at the end of the day, if you have a congregation setting that has so many people, then chances are high that many people will definitely be affected. So that generally explains
Dr. Kabanda, as I
the
see
technical decision taken by the sector.
As I see you off, chances are that there's likely to be a bigger spike along the way. Do we assume that after a couple of weeks, you might advise President Museveni to enforce a harsher lockdown, a more stringent lockdown?
I wish Simon you would start from the positive note. definitely, I would say that our technical recommendation would be in line with the positives that we shall be seeing in the coming few weeks. If members of the public are responsive in nature from the behavioral point of view, then chances are high that what was pronounced yesterday will be eased off. And if things get worse than the current situation, then we anticipate to have geographical lockdowns based on where we shall be seeing rapid increase in cases. And of course, as it was said yesterday, Kampala Metropolitan still stands to be at higher risk. So we call upon members of the public, especially those who are staying within Kampala Metropolitan, to still support, because we are all into it. We want to have a healthy population, and we still want to live normally. For us, from the health sector, it puts us under a lot of pressure amidst low resources. So we do not want to be in a tricky situation, because we don't want to lose people. We have already started seeing situations or cases where people are yearning to actually have access to oxygen and we can't be able to help. So we don't want to be put in a tricky situation as the sector. So our prayers and my request to members of the public, especially now to leaders, that we are having across board is to join hands and ensure that they mobilize members of the public to be more responsive, because this is much more, as of now, an individual responsibility to ensure that we are able to control the pandemic.
Thank you very much, Dr. Richard Kabanda, for speaking to us. That's Dr. Richard Kabanda, the head of health promotions in the Ministry of Health. We're also joined by Honorable Emmanuel Dombo Lumala, the head communications at the NRM Secretariat. Good to have you, and a very good morning.
Yes, Simon, good morning, and good morning, our viewers. Good morning, Lord Mayor.
Lord Mayor, Kampala has been identified as one of the hotspots where the spike of COVID-19 is alarming. Are you pleased, or how do you feel about the restrictions that have been put in place, and the enforcement mechanisms?
From the submission of Dr. Kabanda, correlating it with the statement issued by General Museveni yesterday, you can foresee where we are headed. The fundamental statement is made, the Kenya model, the Rwanda model of a geographical lockdown. And he has singled out the Kampala metropolitan area. You recall earlier on, Mr. Museveni said, the people of the country don't come to Kampala, Nandi Wachiso. And yesterday he extended it to restrictions from movement from district to district. If you are from Wachiso, don't cross over to Mpigi. If you are from Mukono, don't go to Buyikwe. So essentially, he's gradually taking us to a total lockdown. That's how it all started last year. He does it that way. And actually, in a Chiekera way, he was issuing veiled threats to the people of Kampala. He was mentioning shopping malls, arcades, markets, public transport, and whatnot, that if you don't strictly comply with SOPs, in a week's time, we shall be constrained to issue stern measures. Definitely at the end of thing, they are coming. I'm sure they are working on that. Because
what do you think of the timeliness of these measures?
You see, it's granted that there is a crisis. Mm-hmm. It's granted the situation is dire and critical. That's a fact. We can't deny it. It can't be gainsaid that there is that crisis. It can't be denied. But now, what explains it, and what measures should we take? Initially, we messed up this process. And this is where we went wrong. And that's why I put it squarely on General Kaguta Museveni. Let me highlight a few things. One, the reason we had the initial, because the lockdown is not a permanent solution to this problem. We've got to learn to live with it. This is the trend worldwide right now. The initial purpose of the lockdown was threefold. One, to prepare the population for SOPs, because this was a new phenomenon, and we had to adopt the new normal. We had to cultivate a new culture of behavior. So we had to study the behavioral nature of this virus and how we can contain community spreading, so that people get to understand the SOPs, hand washing, sanitization, generally those behaviors. That was bungled up. The other thing was, this was a foreign disease. It was at the border post. And before we get the upsurge within the communities, let's prepare, because we were caught off guard, let's equip our health facilities to be able to cope with the challenges. That's the reason there was a massive drive to mobilize resources. Katongole led a community mobilization drive. And I think the last time we had the accountability was over 30 billion, which had been generated. And what did they do with that money? Mr. Museveni emphasized buying trucks. Today I was shocked when he was announcing the statistics last night in terms of capacity building. That Mulago National Referral Hospital, we have only 27 ICU beds. Regionally, we have 150 countrywide in all the national regional referral hospitals. And we've had how they are decrying the crisis they are facing. They are overwhelmed by these cases. How many oxygen cylinders have we imported? Ventilators have we imported? How many beds have we? Even the ordinary beds are not enough. The total number of beds, 3,700, you can imagine. In a country where you are saying we are in a region of 70,000 infected people. And that was a mistake, number one. And that's why I implore members of parliament, Honorable Bolanya, the oversight committees, your work is cut out. You constitute these committees as soon as practicable to probe these matters and ask these people, the funds, the supplementary funds that were appropriated, why didn't you procure the equipment in time? Because COVID has been lenient to us. Well, let me add the third one. The third one was about preparing for vaccination. Because we wanted to buy time as we discovered the vaccination. Recently, Mr. Museveni told us, our scientists are doing that according to the processes laid out by World Health Organization, a vaccine goes through 8 stages. You can be allowed to omit one. But now we are at stage 4. I expected Mr. Museveni to give some message of hope yesterday, that at least within 1, 2, 3 weeks, we shall be done with all those phases. But my spirit was dampened when he said, India, which has got a new variant, has stopped supplies to Uganda. And that has been our main source. That's where we're getting AstraZeneca. The only doses we imported are only 960,000. 960,000. And the most vulnerable are 3.7 million people. Now, this new variant has now ravaged even the youth, the teenagers, and whatnot. So, why is it difficult for us to import enough doses, either from Johnson & Johnson? Because they have been readily available to suppliers.
Well,
and AstraZeneca, it is 2 doses.
Honorable Dombo joins us now. A very good morning, Honorable. What do you make of the President's intervention as addressed in yesterday's speech on the question of COVID-19 as the country experiences a surge?
First and foremost, Mr. Bana Simon, I want to thank the President. I'm surprised that my friend, the Lord Mayor, is just ostracizing the President. But when you look at the statistics and you compare with other countries, Uganda has performed tremendously well. When you look at the number of deaths, number of infections, and the number of interventions that have happened so far. When you look at that statistics and the decisions that have progressively come, you see that even when some of the actors have acted irresponsibly by either diverting the money or misappropriating the funds that were appropriated, you see that the interventions so far have been able to curtail the spread of the disease. Looking at that alone, makes us to have hope. The second one is the current interventions. You see, initially, this disease is new to everybody. And every day that passes, it manifests new variations from what had already been known. Because previously they had talked about the elderly people as the most vulnerable. And almost everybody thought that the young people can as well get it, but the body will fight it over. But now the new variant shows that even the young people are equally affected.
The Lord Mayor has highlighted the grey areas that the president should have tackled, especially in terms of accountability, bed capacity, vaccination.
You see, the challenge I've told the people, especially the Lord Mayor before, is that he prefers coming to the media houses to talk this, when he could have met the president and they talked about these issues, him as Lord Mayor, because he was given a responsibility and the president together to ensure that they lead the people of Uganda.
But he said this is his own affair. He has personalized
Just a moment.
Yes.
I've seen always the Lord Mayor wanting to come here. The Lord Mayor can look up the president and raise these issues legitimately in their office as leaders. So that instead of coming to ostracize the president or the media houses, they put their heads together with the scientists.
Let me ask you. Just one question.
Just a moment.
Let me ask you.
Yes,
yesterday when he was addressing the nation, why didn't he invite at least the speaker who is there, who is close to him? Why didn't he invite the religious leaders to be there? So that it's multi-sectoral, that we are all at the front line. Why are you singling out Lukwago?
The issue, I'm singling out Lukwago because you are the one speaking here with me. The speaker is not here, and the religious leader is not here, and they have not raised the issues you have raised.
Do you imagine the president has personalized the
because
fight?
He hasn't because Lukwago is a leader in his own right. He was elected by the people of Kampala. And when you look at the most affected area, there is no intervention that we'll be talking about.
To what extent is Lukwago involved in the thick of things, of the fight?
He should be telling us, because he's, to me, according to what I know, is that naturally when you have a multi-sectoral approach, and instead of coming to ostracize other leaders on what they're doing, he should be putting the efforts together, either through council. If the president is ignoring him, then he must legitimately raise it, either through the means of Kampala or through his council, to ensure that the efforts in Kampala should be a multi-sectoral approach, including the mayor. But could be that's his method of work, but me, I think he should improve it.
The spotlight now is on Kampala, areas like Kampala, where the numbers are growing by the day. Do you think political leaders have not played their role, have chosen to stay away?
No, you have heard the Honorable Kwago has very good ideas, but only that he's taking them to the wrong forum.
Can I tell you that?
Because these good ideas, which Honorable Kwago has, just a moment, these good ideas that Honorable Kwago has, if they are put together with the government effort, either through the minister, because he sits with the minister of Kampala, and these are measures affecting Kampala, the people he leads, and the area he presides over. Now the question is, why doesn't he ask the minister for Kampala? Why is he being ignored?
There is no minister for Kampala right now.
Who is the minister?
There is no
the
one.
president.
Now you see. So
because
let me tell you this.
Just a moment.
Can I explain?
Right now.
Can I explain this?
Please do.
You put a challenge to me. I wish you appreciated the troubles we are going through with the technical team there.
In Kampala?
Yes. You'd bring the ED. You bring our director for public health, Dr. Okero. I am telling you, our frontline doctors at KCC are overwhelmed.
By the numbers?
By the numbers. Because the facilities are not adequate. Even the testing, we are just struggling. We used to do the vaccination, but the jabs now out of stock. The testing is damn expensive. Ugandans cannot afford. Because if you are saying Kampala is the epicenter and Wachiso, at least make it free. But now you are requiring people to pay 185,000 per testing. I saw Mr. Museveni mocking Ugandans yesterday that for him he does routine testing. But how many Ugandans can afford that? So for me, we have been mobilizing people to come. When the jobs were still there at KCCA, we have been doing the mobilization.
So the Kampala administration has its hands tied at the moment.
The ambulance system now, you don't know we are struggling. Our village health committees are there, they are ready to help in sensitization, in case management, in locating, in doing the surveillance, in guiding people where to go. But we are asking just one little thing: equip them, facilitate them. Secondly, let us identify, because if public hospitals are overwhelmed, like our cases in Chirudu, Chisenyi is overwhelmed already. What we can do, and I expected this Mr. Museveni to do it last night, get a list of these experts to accredit private hospitals. They are there. So that I can tell people that, please, in case you post certain symptoms, you go to Rubaga Hospital, for example. They have an isolation unit. But Rubaga has not been accredited. You go to Namirembe. You go to Chiswa. No, Chiswa is ours. These private hospitals. Mr. Emmanuel Domba will ask you, how many public facilities have been accredited that they have the required equipment to deal with this pandemic? So that Mr. Museveni said, if you feel like sneezing, coughing, feverish, what, please rush to the health facility. Which health facility?
And you treat that as a mockery?
It was a mockery because you have only 27 beds in Mulago for ICU. Now, your efforts are supposed to be augmented by the private sector. Now you do not accredit them.
The president missed out on the real picture and instead dwelled on politics and mockery.
The private hospitals and the private sector is already playing its part.
Which ones are there? Which ones have been accredited?
One of the
Should
things,
I just rush to any clinic?
And one of the things, Mr. Alkwago, you yourself, you have been in a Rubaga hospital before.
Was I suffering from COVID?
No,
have you confirmed that?
No, I have not said that, but I've said you have been to.
You may not rule it out, maybe.
Because I met you there, I didn't know what you are complaining about, and I also had gone basically for treatment, and I know those medical facilities. So I know when you are talking about those facilities, I know that they exist, and they are already playing their part. But one of the mistakes many people do...
And the information I have...
Just a moment. Yes. The mistakes many people do is to imagine that every flu or every ailment that is feverish is COVID. So the only thing that any rightful thinking person like the president did is to tell you, go to any medical facility. Once they look at you, they will advise, depending on the circumstances, whether you need the referral, whether you need examination, whether you need prescription, and you go and manage your case. But that is their advice. But to imagine that whoever feels feverish, that is COVID, so you must be referred to.
No. He's missing the point, Simon. The issue is about testing. Because you are not so sure. You have this hard cough. You are feeling feverish. You feel like the temperatures are high. Definitely you need to go for a test. Are all these health facilities in Kampala, including ordinary clinics, authorized to do the testing and for free?
Let me tell you, because I've suffered from COVID, and I know that I was prescribed with COVID even without testing. And right now, medical facilities have the ability of doing diagnostic investigations using the available facilities without even testing.
Without approval by government.
Listen, without testing. Because people can use X-ray. X-ray has been very sufficient. Many medical facilities.
For testing COVID?
They use X-ray, they see the diagnosis, they see the symptoms, and they begin treatment. The other one is using the scan method. They have used that, and the interventions have been done. As you wait to do a confirmatory test,
okay.
Just a quick one. Just a quick one.
As we take a break.
Just a quick one. Just a quick one. No, Simon, what he's talking about, he has highlighted a few things. They are talking about the testing. But what Mr. Museveni was talking about was emphasizing, we called it PC what? PCR. And sarcastically, he was saying, my people in Ankole may think it's a night club. You know, I didn't even like the manner in which he delivered the message, the intonation. He made it look like it's a laughing matter. Let me tell you, the way he delivered his message last night, it was full of jokes.
The president depicted a state where there is a crisis.
No way.
There is.
The demeanor, the intonation, the word, it was like a laughing matter.
The decisions that the president has prescribed in his speech yesterday, closure of schools, locking, actually right now there is a partial lockdown of districts, because once you say there is no inter-district movement, that means almost every district is locked within its own district. That shows you the level of crisis and the level of awareness. And if we don't change our behavior so that the statistics that shows progressively reflects a reduction or change of behavior, then we could be going for harder
we're taking
measures.
a break, but the Lord Mayor seems to say that the president was having a lot of mockery in his speech.
But
the demeanor and tone.
which speech has, ever since President Museveni became president, has Bwana Lukwago ever acknowledged that he talked well?
No, there are times when he has talked tough.
Well, let's
But
take
this
a
is a
break,
situation-
and when we return, we'll be still asking one question before we delve into the State of the Nation address. Is the country prepared for the new outbreak? And what do you think of the measures that the president put in place? Be part of the conversation on all our social media platforms. Let's take a break and return. Good morning.